the topic for this presentation is intussusception. And intussusception is a pediatric pathology that can happen. And most commonly happens between 3 months of age and 3 years of age. And most cases actually happen before age 1. So what is it? Well, let's show a diagram and that will clearly explain what's happening. Well, first of all, let's look at this part here, this diagram that I just boxed in. Well, here we have a normal intestine, perfect, completely patent, no problems. Then we have intussusception. And what's happening here is that one part of the intestine kind of goes into another part, and it's referred to as telescoping, where one portion of the intestine telescopes into an adjacent segment, and you can clearly see that there. Now, this eventually leads to a lot of problems, including ischemia and perforation. We'll talk more about that later. Here's another diagram on this side here. Most commonly, the portion of the colon that's involved is the distal ileum. So pretty much the very end of the small intestine, and it telescopes into the cecum. And you can kind of see that there. This is the small intestine, and it's the ileum, it's the distal ileum, the very end of it. And this is the cecum, which is right at the sort of the beginning of the large intestine. And then the telescoping is happening right in that location. So remember that.
I'm Dr. Ron Goldman. I am a pediatrician and work in the emergency department at BC Children. I see children with gastroenteritis every day, at 7 or 8 in the evening. The family with 3 children came in with high temperature, a lot of vomiting, and much more diarrhea. Rotavirus is the most common organism causing gastroenteritis, or the stomach flu. The rate of being contagious within the family is extremely high, 80 to 100%. So if one child is sick at home, it may be transmitted to other kids, to the parents, to grandparents. It does start with fever and vomiting, and only then comes the diarrhea. When a child loses a lot of fluids, they can get dehydrated. Some of them will need to stay in the hospital, get an IV in their arm. And unfortunately, there are also cases of death associated with rotavirus. The rotavirus vaccine is very safe. A few drops in the mouth of a baby will potentially save them from a significant common illness. And millions of children have already received the vaccine as part of their usual vaccination schedule. With all the research we know as pediatricians, preventing the illness by giving a vaccine is much less risk than contracting the illness. It's such a common phenomenon. Why not prevent it? You're going to protect your child. You're going to do everything you can. Vaccination have changed the map of pediatric illness. Vaccines are safe, they're effective, and they've been shown to make a huge difference for individuals, for families, for big communities. Millions of children and now adults live today thanks to vaccines. So when you are looking for information, ask the right people. Search in reliable sources in order to hear what public health is recommending. And they're recommending taking immunizations. These are the protectors of our children.
Regular trips to the doctor are a normal part of a child's first year. Baby Jose, baby Stanislav, and their moms are here to see their pediatricians at Harvard Vanguard in Boston.
Hi, Stan. How are you?
During this visit, both babies will receive routine immunizations, including the rotavirus vaccine.
Immunization is very important because it protects them against vomiting diarrhea disease that is very common for babies.
Several years ago, a rotavirus vaccine was withdrawn from the market after being associated with an increased risk of intussusception. In this uncommon disorder, a portion of the small or large intestine slides forward into itself, much like a telescope, causing severe abdominal pain and vomiting.
Because the rotavirus vaccine is given to almost every child in the United States, it's crucial to monitor the vaccine's safety.
Dr. Irene Shui from Harvard School of Public Health and co-authors studied the Rototech rotavirus vaccine, which became available 6 years ago. Almost 800,000 infants aged 4 to 34 weeks received this vaccine from May 2006 to February 2010, including more than 300,000 first doses.
Our study did not find an increased risk of intussusception following the rotavirus vaccine.
The study appears in this week's JAMA, Journal of the American Medical Association.
This result was the same whether we looked at the longer 1 to 30-day risk window following all doses of vaccine, and in particular, when we looked at the first week following the first dose, we also did not see an increased risk.
We're going to do rotavirus. That's a little drink. That's a little drink.
Researchers say introduction of the rotavirus vaccine has a tremendous public health impact for children like Jose and Stan.
The benefits from rotavirus vaccine in terms of reducing the number of hospitalizations and deaths from rotavirus disease far outweigh the potential risk of intussusception that might exist.
Thank you, Angel. You're doing great.
Catherine Dahl, The JAMA Report.
Get influenza after receiving the flu shot because it is made up of dead virus particles of influenza strains expected to circulate over the coming winter season. When these fragments are injected, the individual's immune system responds by producing specific antibodies which protect the vaccinated person against infection. Following immunization, some people may experience mild flu-like symptoms, which usually go away within 48 hours. A result of your immune system responding to build protection. Because the vaccine is made up of broken up bits and pieces of dead influenza virus and not the live intact virus, it cannot cause infection. In fact, getting influenza from a flu shot is akin to asking ground chicken to lay an egg. It's just not possible.
The immune system protects us against germs that can make us unwell. It makes special blood cells and antibodies which help to do this. The first time your body meets a new germ, your body may not be very good at fighting it. That's because it takes time to make the blood cells and antibodies required to fight off the new germ. It's during this time that the germs can sometimes make you unwell. But a healthy immune system will eventually make the blood cells and antibodies that fight off the germs. Once your immune system has encountered a germ, it doesn't forget. The next time the same germ enters your body, your immune system is able to respond more quickly, destroying the germs before you become unwell. This is called immunity, and that's what the immunization is all about. HPV immunization works by making your body remember the most common kinds of HPV that can cause cervical cancer and genital warts. The HPV vaccine contains little particles that look the same as some of the particles on the outside of the real virus. Because they are only particles, not the actual virus, You can't get HPV from having the injections. They'll just trigger your immune system so you can fight the HPV virus if you need to in the future.